Alrighty. I think everybody in here so far has already gotten their hypothetical case study. It is just like the last one, basically. We know that basically the first, third, and fourth pages are pretty easy for you guys. So let me mark. I see a couple people coming in. Robert's there. And Stockade in the hallway. Okay. So this one, not going to read through it or anything, but you've got a hypothetical case study that has plenty of stuff going on to, require recreation therapy programming for sure. Again, when you start doing this stuff, you can't go too wrong on the first page. You're coming up with just answers straight from the hypothetical study. From there, it's the planning page where you go into goals and objectives that's going to make or break this assignment. So I'm going to grade this one harder because we've done it once. I gave you the feedback. If any of y'all have questions about exactly how to do proper objectives and goals, hit me up and we'll try to find a time to, if nothing else, do a Zoom call or something like that. But there's in the content, there's I think it's listed up there, that proper objective writing sheet where it's broken down into condition, behavior, and criteria. So each objective needs to be sure that you have those 3 items there. This is going to be due 1 week from now. So next Tuesday, bring it on the 30th. We will not have class next Thursday. Free gift, just because the second class, they're doing something. The class after this, they have an out-of-class assignment that they're doing, and I traded them that day for doing it out of class. So y'all are just basically getting a free day out of the whole deal, because now you got a 4-day weekend basically that can start earlier. So I thought that was a good day to do it, since it was right before the holiday on the Friday. So let's see, let's start with this YouTube video. Some of you who are in 388 after this saw it at the end of class last time. If you've seen it already, it won't hurt you to see it again, because this is kind of a good video. It showed this. Now this is for developmental disabilities primarily, this facility, but this video will make you feel good, and you see a lot of different adaptive recreation activities going on. A lot of smiles, a lot of positivity in this little clip. So we're going to share this and go from there. Okay, just a minute ago, people who were in here a few minutes ago can vouch that the sound was working. So I don't know what happened there. Is it just coming through up here again? All right, I'm gonna start it over since couldn't hear the first part.
we would choose them to kind of bring it back to them, that we get to play at home.
Play basketball in the bridge. I have a racket, like to see my friends.
That is one. I play video games, color, socialize. You can make friends and you can do many different things. I have a friend that her name is Alicia. She's my favorite best friend, and I love people so much.
Therapeutic recreation is the use of recreation activities as a treatment modality to address the assessed needs of individuals here at Blythedale. Will help them develop new leisure skills, help them reintegrate into the community, and try to make sure that when they leave here, they are better off and more capable to do the things they enjoy. They have really full, busy schedules throughout the day, and so they need time to unwind at the end of the day. It serves as sort of an escape for our patients.
It helps them recognize that even though they may have a different difficulty now, whether it be physical or cognitive, that they can still achieve the things that they used to love doing, and they just have to figure out how to do it in a different way.
So we have therapeutic recreation throughout our hospital on both our inpatient and long-term care unit. On any given day, you'll see us engaging in a lot of really fun activities like Junior Chef, where they team up with our dietary team and really have an opportunity to create their own food. And it's all about bringing choice and opportunities that are things that they would have access to in their own life. The goals of therapeutic rec are truly ingrained in bringing the childhood spirit into the hospital. So on long-term care, our therapeutic rec staff is often engaging with kids in a lot of different sensory experiences, reading to them, ensuring that those really important developmental experiences are available to them on a daily basis. It really allows us the opportunity to bridge some skills that they're working on in therapies with things that are really important to them, real life things for them.
Here at Blythedale, we focus on what our patients can do rather than what they can't do. I think each kid that we have here is a hero in their own way.
To me, the Blythedale difference is having a really vibrant-based team behind our medical providers really encourages us.
I really think it's important to treat the person as a whole, putting the fun and functional. We just like to have fun here at Blythedale.
I just thought that was a good little clip. Putting the fun and functional. That's like a little cliche thing that they did there, but it's true. That's what we try to do. And they talked about having a group of people that are energetic and able to come up with a lot of different. Did you see the wide range of clients that they work with there? I mean, you had the one that was, making her own burrito or whatever. She seems very high functioning, very capable of doing probably almost whatever they want her to do, all the way down to the boy where he was in the wheelchair and she was just working with his arms. Like, they have a big range, it looks like, of level of effectiveness on, how much they are affected with their disability. So I thought that was a good place. It just kind of sums up one of the groups that we can work with in recreation therapy, and some different, gave a lot of, something I liked about it, just to think about. You might not think of anything like cooking or food, food prep or anything being a recreation therapy activity. But how often do you think that these kids, and I say kids, they may not all be kids, but it looked like they were all pretty young. How often do you think they get to make their own food? Like, never, basically. So, for me and you, I love for somebody to make my food for me, because then I don't have to do it. For them, that would be an opportunity to do something that they don't usually have the chance to do. So it would actually be fun. And we've talked about this thing before, least restrictive environment, where we want them to be able to do as much for themselves as they can. So activities like that help to get there. If they learn how to do some cooking skills and some things like that, that's a positive for sure. All right, let's share again here. Let's go to chapter 12. I'm going to try to get through 12 for sure, maybe even 13 if we can. just because I want to, even if I don't get to hit them as deeply as I would want to, I'd like to get through these chapters and at least give y'all some exposure to all of this stuff. We'll go to the. So this chapter is all about assertiveness training. And think about our clients in a lot of these, especially, like long-term care facilities. You've got people that care for you. You've got people that, in a lot of cases, tell you when to get up. You've got a schedule. This is when you're supposed to go to, education class. This is when you go to the workshop. This is what time we eat. This is what time we're going to take showers at 7:00 p.m. You don't get to make a whole lot of choices. So what would that kind of condition you to be as far as assertiveness? Would you eventually just kind of lose some of that, hey, this is what I want to do? So especially for, there's times when we are the advocate for our patients, and then there's times when we as a recreation therapist need to kind of instill in them that they need to be assertive in some times and say, hey, no, this is what I want to do, because we don't want to just run over our clients. We want them to be bought into what we're doing, know what we're talking about, and go with what, because they want to do it, So assertiveness, what would y'all say? What's a definition of assertiveness to you guys? Being direct can be, absolutely. What's another? Getting things done. Yes, those are both. Yep, not being afraid to make your needs or thoughts known is, another good one. Those are all good. So we're going to talk, we just defined it. We're going to talk about different groups that we're going to work with. So let me just start shooting through this thing. So assertiveness, they've got a definition here. It's a trait, a behavioral style, a communication style, and a skill to promote positive relations and self-esteem. If you are assertive, you're going to feel better about yourself rather than if you are just allowing everything that's told to you just to be so. It kind of breaks your spirit. So that's how it's positive. It promotes positive relations and it improves your self-esteem because you're making your wants and needs known. Assertiveness is used as a behavioral therapy to help individuals function better in everyday life. You get to a four-way stop. Who's assertive at a four-way stop when you and another car pull up at the same time, and you're both sitting there just kind of edging out? Some people have that assertiveness where they're like, no, I beat you, I'm going. Some people are going to just sit back and wave everybody by. Not necessarily, but that's in life. That's kind of a daily thing that we run into that kind of shows assertiveness to a certain degree. So who are the clients that we will probably have to work with or could work with who may need some assertiveness training or nudging to try to help them realize that they need to be assertive? Individuals with physical disability, wheelchair users. I've seen in a lot of cases, though, wheelchair users are kind of inherently pretty upfront about their needs. If they have trouble, if there's not a ramp or if there's not a wide enough door, they're going to let you know for the most part. So assertiveness, most of the time, that's not a group that I've seen it happen a lot. Individuals with visual impairments, chronic pain, eating disorders, at-risk youth who demonstrate difficulties with interpersonal communication. you know, communication and assertiveness kind of go hand in hand. You know, if you don't feel like you're able to communicate appropriately and properly, then you're going to be kind of shy to be assertive. Victims of violence and abuse. That one sticks out, and that would be an obvious case. Someone who's been abused. I mean, think about a dog or a puppy that's been abused. How is it when you meet it? Is it assertive? Not at all. It's, you know, it's cowering down, it's hiding. And that's the way that people are if they've been in similar situations. Marginalized groups, such as women and the elderly. Some, you know, some women are in relationships where they don't have the opportunity to make many choices. I mean, there's some, you know, back in the day, way back when, that's just how it was expected to be. The man made the decisions and the woman just did it. And it's changed, and that's a positive thing. Elderly, they are a lot of times, they feel unimportant, and they need a little, you know, if you boost their confidence a little bit, they're going to become a little more outspoken and a little more aggressive and you know, with saying what they. Now, a lot of elderly people, I don't know if assertive would be the way I would go with this, but they'll tell you exactly what they think. That's one thing that I can say. You know, I'll never forget, I was like 13 years old, and you know, when you're growing up, at least for me, I'd go from skinny to kind of bigger, and then skinny and kind of bigger. And well, I'm still doing that now, and I'm 45, but still, when I was growing up, it really happened. And I'll never forget my granddad. I went over one day and he said, "Boy, you getting fat." And it just hurt me. You know, like I was like, man, how do you just say that to somebody? I didn't eat for like a week because I was so mad. Like just tore up about it. Like, but some of them, that was just a little tangent off to the side. Some of them will say exactly what they think. That's for sure. Individuals with mental illness, especially those who have depressed or suicidal thoughts. You know, depression, if you think about being depressed, that is not a very assertive state. You don't care about anything, you know. So you can see where that would play in. Adolescents susceptible to peer pressure to drink alcohol, smoke, ingest illegal drugs. That's where you would talk to them about assertiveness and saying no, you know, saying no to the peer pressure. People with substance addictions, participants with disabilities who may be in a sheltered workshop, residents in institutions like nursing homes and hospitals. Again, like I say, in those facilities, in those locations, so much is decided for you that, you know, a lot of people lose that assertive factor that they need. And school children at risk for bullying. Now, we know, you know, I've told my own 7-year-old kid that he had a speech issue, and even now at 7, he has trouble with his S's to a degree. And, you know, he hasn't, knock on wood, he hasn't been dealt with a lot of bullying or anything like that to this point in his life. But, you know, I've told him, just as I was told when I was growing up, that if he's ever feels like he's getting bullied or something like that, that he better not start anything, but not to let anybody pick on him either, you know. And that was my way of, you know, kind of promoting assertiveness in him, as to not let him get run over by someone, you know. And if he was getting picked on or something like that and ended up getting in trouble at school, I would take up for him, because I think that's what you should do. So in order to promote assertiveness in our clients, there's basic premise of it. Assertiveness training provides a mechanism for coping with social anxiety, because that's what sets us back from having that assertiveness a lot of times. You've got this social anxiety where you don't feel like you can speak up or stand up for what you are feeling. But it helps to cope with anxiety and emotional barriers that can interfere with recovery and successful community reintegration. That's, we talk about least restrictive environment, and we want people to be in the community as much as possible. And in order, if they're not under the care of someone and they're out in the community, they have to be assertive. They have to kind of be a little more go get it, go get what I need, take care of this situation. You can't just sit back and wait on everything. They have to be assertive. So that's kind of a training that they need before community reintegration. You need to make sure that they are assertive enough to take care of their own needs, and their own well-being, that they're not being taken advantage of. It teaches people strategies for acting on their desires, their needs, and opinions while remaining respectful of others. That's, when you think of assertiveness, I know some people that are very assertive. A couple of them that come to mind, they are, and this isn't a negative thing, the two that do come to mind are military background, and they're very overbearingly assertive. And I think it's from that, they've been in charge of groups, and they carry it over into their normal life. So they're making, they're acting on their desires, needs, and opinions, but not necessarily being respectful. And that's part of the training, to make sure that people know that there's ways to be assertive yet be respectful. So there's some different programs. Here we go again into some of these models. So this book, if you're looking at recreation therapy as something you could do, you might want to hold on to this book, because it has all these models, and it will give you some good ideas for, these models that you can look up and dig into deeper and actually use some of these if you want to work on these things. But this one, the Handbook for Communication and Problem Solving Skills Training, their components of assertiveness training are instruction, where you kind of tell them what is expected, what can help them. Then you're going to have supervised practice, where you watch and see them. I picture this being kind of a role play situation. Okay, now I want you to talk to him, and I want you to tell him that that's not what you want to do, that you want to go outside in 30 minutes, whatever. You're prompting some assertiveness, and then you supervise it. They're getting practice on doing it, and then you give feedback on how it's going and how you view they're doing as far as being assertive. And then you kind of give them some homework, which would be independent practice, and say, I want you to work on doing this, and next time we meet, I want you to tell me some times where you were able to be assertive. So that's one of them. Pretty straightforward, simple pathway right there. Another assertiveness program. This one's out of Vancouver, Canada. It's got 12 topics that they cover. They go over the definitions of assertive, passive, aggressive, and passive aggressive. Can anybody think of a good example of being passive aggressive? I should be able to, because I get accused of being that way sometimes. Yeah, you're avoiding conflict directly, but you're kind of being snarky in the way that you are doing it. I don't know a good example off the top of my head.
I know one time I knew of someone, they got lectured about something, and so like you said, they were being snarky about it, but what they did to kind of take it that extra step, they used the exact wording that the other person said to make them think oh, so this is what you're mad about.
Gotcha. Yeah, that's true. Okay, passive aggressive would be saying, all right, you turned in a good assignment. It really wasn't quite as thorough as I want. You know, it's it's supposed to be a 1-page assignment. And say, I'd really like to have a little more content. And then you turn in a 25-page thing just to be a smart A. That would be passive aggressive. You would be saying, hey, I get it. And here's more than you ever asked for. You know, that's passive aggressive, you know. And so in order to teach them what we're trying to fix and what we're trying to help them with, they have to know what assertive actually means and what passive means, you know, because that's probably what they are if they need this training. What aggressive is, because assertive and aggressive can get kind of interwoven and interchangeable sometimes. They're not the same. Aggressive is different than assertive. Generally, assertive is more appropriate. Aggressive a lot of times is not. So then they look at barriers to assertiveness. You know, what is stopping you from being assertive? Have you been, you know, held back from being assertive in the past? Things like that. You let them know that they have assertiveness rights, the rights to be assertive. You go through some nonverbal behavioral styles. You know, when someone is not, you know, if you're talking to somebody and they won't give you eye contact and they're just kind of look nervous, that's not a good nonverbal behavior for being assertive, especially if you're, you know, going to come back with an answer or something. You're not setting a good framework by your nonverbal cues are not showing that. We talk about giving opinions. And giving opinions is a big part of being assertive. When you're non-assertive, you're afraid to give your opinion and your thoughts. Being able to accept compliments, being able to cope with criticism. I think everybody has a little trouble with that. You know, who likes to be criticized? No hands? Okay. Yeah, me neither. I don't like. Okay, we got one in the back that just kind of lives off that stuff. Nobody really enjoys being criticized, but we need to realize that, especially if it's done in a well-meaning way, that it's, you know, it can be a positive thing. You know, positively critical it can be helpful. Giving constructive negative feedback. Saying no. Who has trouble saying no? I'm even that way. That's why I'm on the coronavirus contact tracing team here at the University of Mississippi, working in conjunction with the Campus Health Network and the Mississippi State Department of Health. That's why I call all these people on the phone, because I couldn't say no when I was asked if I would be interested in helping on the team. And I really needed that as I'm teaching 5 classes and over about 20 something interns right now. It's the smartest, dumbest thing I've ever done. I'll just put it that way. So yeah, people need to know that they can say no. Making effective requests, the way we ask for things or the way that we request things, a lot of times it matters the way we ask it and the way that we approach someone, you know, as to how effective it's going to be. And dealing with confrontations is the last thing that they have listed here. When we're in a confrontation, there's an assertive way, there's an aggressive way, and those are different. You know, you can be assertive and still see yourself away from the situation. Being aggressive is going to generally escalate what's going on. So they talk about dealing with confrontations and being assertive yet not aggressive. Here's another one, and it's got one of these, you know, the letters stand for the thing. I can't remember the name of them. DESC. Acronym. There you go. Thank you. DESC right here. They describe the behavior. They express feelings using the I message, where, you know, the person actually is going to say, I want to, this is how I feel. You know, it's not, this is how you make me feel. It's more of a, I feel this way. This is what I want. They're going to talk, when you're talking from the I perspective, you're going to be more assertive. S, state what the complainant wants the listener to change. So you're laying out exactly what you're seeing as far as lack of assertiveness. And then K represents knowing what the listener is not going to change. There's some things that you know, your listener, your client, your patient will straight up tell you that they're not going to change in certain ways, or there may be some ways because you know of their background that they're not going to change. And that's kind of what that's referring to. Here's another one. They spelled desk wrong on this one. DESC. You describe the situation, express your feelings regarding the situation, specify the change that you desire. This is very similar. And C refers to identifying the consequences that could occur. So that's the thing. You kind of need to talk through, like when you're more assertive, this could happen or this could happen. The person you're being assertive with could become confrontational or aggressive, or it may be a very positive situation where you start to gain a lot more rights and a lot more, it'll become easier to you as you start seeing this work. So consequences can be good or bad, so you would talk about those. So as far as therapeutic recreation and assertiveness training, some things that have been seen, leisure education, counseling, social skills development, and stress management programming include components of assertiveness training. That's where you are going to find that. Like, it's part of leisure education where you help them to find what's available to them and choose it and say, I want to do this. You know, you help educate them on new leisure activities that they'll want to do, and they will be assertive enough to say, this is what I want to do. Social skills development, if they don't have good social skills, assertiveness is not going to really be there. So social skills training will help with assertiveness training. Stress management, we talked about, you know, depression, anxiety, things like that holding you back from being assertive. That's where that comes in. Selective assertion. You have to think about, there's sometimes where we need to be assertive and sometimes where you just need to go with the flow. And during some of these, you know, leisure education talks, you can talk about the times that, you know, maybe you just need to go with the flow and not rock the boat, as they say. A lot of times role playing works in the context of the leisure experience, and choosing assertive behaviors and preparing your client for the outcomes is important. That's like we said, we need them to know. Now, when you're assertive, you could have this happen or this happen. Give them some ideas where they're not just stepping off the plank into the unknown because they've never done this whole assertive thing before. So you're kind of giving some ideas about what may come out of it. They've shown in research outcomes, higher assertiveness responses in both general and disability related interactions after assertiveness training. Less binge eating behavior has been demonstrated, and improved social function of patients who have eating disorders through assertiveness training. I'd have to look into that a little deeper. I don't really see how those two fit too much, you know, other than assertiveness is making choices, you know, and saying what you want. I guess you're being assertive with yourself and that you're not going to binge eat, you know, because eventually, if you start being more assertive in general with people around you, with your environment, you'll learn to be more assertive with that voice on your shoulder telling you to do something that you shouldn't do. You'd be better prepared to tell that, you know, the devil on that shoulder, no. It's shown a significant increase in assertiveness and a significant decrease in social anxiety in acute psychiatric patients that were in a military hospital. And it's been shown effective as a preventative intervention for adolescents residing in a rural setting. All right, and we'll stop share here. Let me see, where am I? Chapter 12 done, that was good. Everybody got your hypothetical case study? It's due 1 week from today. So bring it next Tuesday. Next Thursday, we won't have class. All right, I'm gonna show y'all another video real quick. Gosh, it went away, but I'll find it. Here we go. Now, let's try this again. Now, this is pretty cool. I liked this one a lot. Disability does not mean inability. Uh-oh.
Press the full screen here.
You can't have it just because you want it, Remember you're dealing with me, Walking and I'm moving like I got it, This baby confidence is key, Now watch me, Flex. Now watch me,
Half court.
Watch me while I, watch me while I, watch me while I,
He didn't even watch that when he knew it was in.
I'm always on my grind, I don't got time for we. All that noise that I hear, I don't need that, I'm free. I got people in my ear, I got places left to see. You got me on your mind, but I'm not trying to be. Now watch me.
All right, we'll watch the ad because this is too good to skip. How many of y'all would feel sorry for yourself if you were in his case? He doesn't. All right, where'd our sound go? We need that back.
Watch me while I, watch me while
All that diamonds on her wrist, yeah, that's so annoying. All that haters to my tip, yeah, that's so annoying. 100 times I flip the brick, cut it, then export it. 100 million in the ditch, bury it and hoard it. I know what you thinking. All this dirty money got me stinking. Work that girl and sink it. Bring that back and keep it. Hey, flex, work it, flex, work it.
Indoor, outdoor, he don't care. All right, y'all get the gist. How many of y'all would, like I said, what if you saw that guy, would you expect that? Next time y'all are around a basketball court, try to go to half court and shoot underhand and see how many you make in a row like that. This guy would just be all right if he had a little confidence, you know. He knows he's good. You can tell it. But that was a beautiful sight to me to see somebody, because he's affected lower limbs, he's affected upper limbs, but he's still, I bet he'd beat you at horse. Just saying. He could snooker some people on that. All right. Because I'm trying to get through this stuff, let's shoot into chapter 12, guys. Let me share the screen. Or 13, actually. All right, this one's about physical activity. And we know that physical activity is a huge part of therapeutic recreation in a lot of cases. Now, we know that therapeutic recreation is not just physical activity. It's not just getting somebody and doing a workout with them. That might be a personal trainer doing that. If you're doing something that is going to help them physically, it needs to be recreational and leisure-based in nature for it to be actual recreation therapy. So we'll run through this chapter and talk about physical activity. A lot of this, especially this first part, common sense for you guys. We know that lack of exercise is a risk factor for what kind of health conditions? Come on, this is easy. Y'all hit me. Obesity. Diabetes.
Heart problems.
Yeah, heart problems, high blood pressure. We all know that being sedentary is a negative. So we already knew that before we ever came in here. Lack of adequate exercise is an even greater problem among those who have pre-existing conditions, because, if they've got issues that make it harder for them to be active, unless they're just a very strong-willed individual like this guy that we just saw in the video, he didn't allow himself to sit and not be active. I mean, he was in there running drills. He's serious about his basketball. He didn't allow himself to be inactive. But a lot of people who have pre-existing conditions do, because it's more difficult, because they don't have someone, let's say, helping them to be more active. I started to say pushing. And in ways, that's what we have to do, because we have to be motivators to get people to try to, you know, we can help them, but they have to buy into the fact that they have to help themselves. So that's just something to kind of think of and remember. People with disabilities are at a significant disadvantage when it comes to complying with recommended physical activity guidelines. Number one, you know, it's harder for them to do. Number two, they may be in settings where, you know, their schedule is made for them. And if there's not physical activity implemented into their schedule, then they're not going to get the activity that they need. Also, older adults who are asymptomatic are also at risk. My mother, she gets a lot of activity because she keeps my two youngest kids every day. But as far as anything beyond that, like she fits in this category. She doesn't do anything else for exercise. She doesn't go for walks. She doesn't, you know, think it would do her some good to get her heart rate up every so often. Other than when she's mad at my dad and it makes her heart go up, you know. But older adults who are asymptomatic, they don't have something telling them, oh, look, I need to do something. They find it easy. You know, when you get older, and I'm older than y'all, and I can tell you, and I am less inclined to just want to go do something super active than I used to be. You know, I'm a little more sore in the morning. My back hurts a little bit more and things like that. So especially when you get older than me, you're talking about, you know, older than 60s, you know, stuff like that. With no symptoms, it's easy to talk yourself out of being active and getting the appropriate amount. Something that we do know is how somebody feels physically has a huge effect on the person's mental health. Their mental disposition and your mental condition can affect your physical health. So it's interrelated both directions. I had a time where I hurt my back and it was bad for like 2 months. I struggled with my back. And honestly, I saw it affect my mental health because I couldn't do a lot of the things that I wanted to do. And when I would do things, it hurt. It breaks you down mentally after a while. So people who have, you know, chronic pains or disabilities that make things hard, it's going to affect the mental side for sure. This guy, Hans Selye, there's a mind and body connection that we just talked about. Focus on how stress affected health. Diseases adaptation result from pathological coping strategies such as excess drinking, eating, and smoking. And those fit into what we've talked about in here a lot of times as coping strategies. You know, people get stressed out. They want to take a drink sometimes or smoke a cigarette. I've seen it happen. There's a connection between the mind and body, and it occurs between the hypothalamus and the pituitary gland. And we're not in A&P class, but that's where the connection kind of comes together there. Those two structures are largely responsible for regulating our internal physiology. And when there's an upsetting or threatening stimulus, that's going to provoke a series of interactions between our mind and our body that if it happens chronically, repetitively, it can lead to a stress-related disorder. You know, if it's something happens over and over and over, it's going to build up and you'll start being scared that you're going to feel that way again. So some of the groups that we need to that you will work with in recreation therapy that, you know, need physical activity, older adults, we talked about them, individuals with mental illness. You think about seen any like old movies or old clips of institutions? What did mental illness used to look like? Where'd they go? Yeah. Prison. Is there like, you ever seen like in the movie where there's this room and there's like 2 staff in there maybe and like 50 mentally ill patients and they're all talking to themselves and like, it's in movies and I'm not making fun of it at all, but like in that situation until recently, and with recreation therapy and some of these other groups that are starting to see, you know, look, they're not getting physical activity because we're keeping them locked up all the time. You know, you have to do it in safe ways and safe places. And if you have someone who's a threat to hurt themselves or others because of this mental illness, then you have to have strategies to go about it. But they still need, if you're in their care and you're on their side and you're their advocate, you got to make sure that they're getting some physical activity, even if it's not the easiest thing for you to make happen, okay? And then obviously people who've sustained a spinal cord injury, they're really going to lose a lot of physical activity. Aquatic therapy locations are good for this. There's special facilities who work primarily with spinal cord injuries. A lot of some of those places have recreation therapists on staff as well. So here we go, back to like an exercise science class here. Some guides for practitioners. You want to perform moderate intensity exercises for 30 minutes, 5 days per week if possible. You don't have to be there with them. It may be something where they can do it on their own. And what we're calling moderate intensity, we're talking about brisk walks, 3 miles per hour on a flat surface. 3 miles per hour that's just a nice steady walk, you know. Moderate intensity aerobic activities, in addition to regular and routine activities, should be completed in bouts of at least 10 minutes or longer. That's going to show you the cardio, you know, actually help build your cardio. But you need to go for, you know, 10 minutes or longer to try to strengthen those cardiovascular system components. Strength train at least 2 times per week on non-consecutive days, 8 to 10 exercises that work all major groups and to a point that produces substantial fatigue. This is going to vary with who you're working with, where you are, what kind of facility you're at, what is available to you as far as exercise equipment. Do you have a hiking trail? Do you have a recumbent bicycle? Do you have a treadmill? Do you have elliptical trainers? Do you have weights available? Do you have stretchy bands? I mean, whatever you have, you can get physical activity. And gosh, you can exercise with milk jugs with water in them if you don't have a budget. Sometimes you got to think outside the box and come up with things that people can do. I mean, did y'all see Rocky train in his movies? What did he do? He carried logs on his show. I mean, you probably wouldn't want your clients doing those things, but he was running in the snow in Russia and pushing cars and all kinds of stuff. He didn't have equipment. If Rocky can do it, surely they can do it. Some more basic premises that have to do with activities. Recommendations for older adults and those who have significant chronic conditions. They're going to be a little bit different. The basic recommendations are going to remain the same, but the intensity needs to be adjusted according to the individual's ability. You don't want to push someone so hard that you're going to put them at risk. You know, if they have diabetes, you need to make sure that you're not taking them into a super low blood sugar situation by pushing them too hard. If someone has asthma and you know that, you don't want to take them out on a super cold day and have them do a hike up a steep hill. You know, you're liable to set them into an asthma attack. You know, things like that you got to think about. strength train, you want to do more repetitions at lower resistance at a level of moderate intensity. And for older adults, they should also practice flexibility and balance exercises. What's the benefit of that? For our older individuals, what do you start seeing when people get older? They fall, absolutely. So increasing, not just balance, of course, balance is a big thing on keeping you from falling. But if you think about it, flexibility plays a big role in that too, because that's your kind of your riding reflex. If you're flexible enough to, if you see you're about to fall and you have enough flexibility that you can offset it, you may not fall. So those two things go hand in hand with cutting down on falls. And that's something that is, you know, pretty prevalent as people begin to age, the falling. And that's something that you need to watch for as a recreation therapist with the activities you're doing with them. If you are doing outdoor hikes or walks, you may want to take your more, and you've got, say, a hiking trail that goes up a hill and around, and it's, you know, it's kind of rocky and difficult or something. You want to take your younger, more able people on that. You want to take your older individuals who are at risk of falling on a little less, maybe a little less exciting walk, but probably more beneficial walk on the sidewalk around the facility where you're at. They'll probably get just as much or more out of it than your others, but you just have to use common sense on that sort of thing. Overload principle, that's all about stressing the body with more physical work. You're doing more than what you're kind of used to. That's how you get gains with, you know, in regards to, you know, weight training. You know, without overload principle, you're never going to go up on your max. Applies broadly across many systems in the body because the human body is adaptable. We have to remember that favorable adjustments in physiological mechanisms are going to result. You're going to see good outcomes because the body is adaptable. Before beginning any assessment program, assessment is necessary. It may not necessarily be you, it may be a physician on site that gives the okay that they can exercise. Now, you may need to tell them the sort of activities that you're planning on doing where you can get that thumbs up or thumbs down from that, you know, physician or whoever may be doing that. This AAHPERD, Functional Fitness Battery, is something that can be used as an assessment as a recreation therapist. It assesses upper extremity strength, hand-eye coordination, flexibility, agility, endurance, and body composition. So that's a pretty well-rounded assessment that gives you a lot of information. Speaking of that, we'll probably look at that one before the semester's over in 388 for those of you who are in that class. As far as applications to therapeutic rec and having to do with research, older adults, those with one or more chronic conditions, a good thing to do with them, outdoor exercise trail used for 12 weeks, 3 times per week, and aquatic exercise for fibromyalgia. Fibromyalgia, we haven't talked about it much. Does anyone know anybody with fibromyalgia or kind of know what it is? It's chronic pain is what a lot of it comes down to. People's skin hurts, even their muscles hurt. It's hard to, there's a lot of tiredness with fibromyalgia. And the thing about it is you look at the person and there's no outward symptoms. And people think that people with fibromyalgia are just lazy and don't want to do because they can't see anything. So that's where sometimes as a recreation therapist and being our client advocate, we may have to kind of break that stigma and put it out there for someone who, if we hear someone talking bad about someone who has fibromyalgia, it's kind of our role sometimes to step in and say, look, this is a situation that is, you know, you can't see it from the outside. You don't know what it feels like unless you have it. But aquatic exercise is really good for fibromyalgia, especially in warm water. It seems to help even more. People with significant mental illness, psychological impairments, and behavioral issues see benefits from physical exercise increases. Cross-country skiing is something that was positively related to persistence, willingness to continue treatment, and anger management. I could see where it would kind of help with anger management. It's that just repetitive, you're out there, you're in a peaceful environment, you're just kind of can get in your own little zone. You have to concentrate on what you're doing as you're doing it. So it would be calming, and I could see where that would help with anger management, and I could see where it would be enjoyable. So obviously that would help with the willingness to continue treatment. You know, you're going to see benefits, and when you're seeing benefits, you're going to buy in and you're going to keep doing things that you're seeing benefits from, obviously. I mean, if you get a job and you start getting extra money, you're going to start liking that. So you're going to keep on working because you want to keep getting that money. You know, things like that, just that simple. People who've had spinal cord injuries, swimming 3 times a week for 15 weeks was shown to improve performance on a swim test and decreases in percentage of body fat. So a little more about research. Aquatic exercise programs are the most common in therapeutic recreation literature. There's actually, I don't know how many of you guys are interested in aquatics. Aquatics and recreation therapy can be very closely tied, and you can use an aquatic environment for so many things. And one good thing about it is it gives individuals who maybe they have a hard time standing up on their own. You put them in the buoyancy of water and they're able to walk basically on their own when they couldn't do that on land under their full weight. You can give them an environment that allows them to be more independent and see positive things, and they're going to leave feeling good about themselves and about what you've done. Small sample studies have demonstrated functional improvements with older adults who have arthritis, fibromyalgia, and people with neurological impairments. Strength training associated with functional improvement has been shown to improve their functionality. Walking and strength training have been correlated with fewer respiratory infections. So, you know, when you're exercising, walking or strength training, generally your breathing is going to pick, so you're kind of training your respiratory system along the way. You know, if you think about exercise, a lot of times you're going to be breathing heavy. So you're training not just your cardiovascular, but you're also helping your respiratory system. You're building your immunity through exercise. One thing that was interesting, and this is used in recreation therapy, gardening did not produce functional improvement in research. Should we just scrap gardening as an idea for rec therapy because of that? No, because why? Because it can give you benefits other than just, you're not going to get cardiovascular benefits from gardening. Are you going to get relaxation benefits from it? Are you going to socialize probably while you're out there doing that? Are you going to have a sense of, hey, I did this when the plant that you planted actually comes up and you eat a tomato off of the plant that you did? That's you know, when you start something and build it and it comes to fruition, you feel really good about yourself. So I think gardening is still an excellent thing if you're in a facility, a situation where and you have a semi-green thumb. I don't. But if you know anything about growing and doing that sort of thing, I think it's a good thing to do. Just know that it's not really, I mean, it could help some with maybe flexibility with some of your older population that, you know, have a hard time getting up and down and up, you know, it can't hurt. But it's through this research, it didn't show a lot of functional improvement. That's all that was said there. But that only has to do with the physical side. Large percentage of persons with disabilities are physically inactive. We know that, especially the older population. We didn't need research for that. And there's the summary. And I'm going to let y'all off the hook for this day. Next class, we're going to cover the last chapter, and we're going to watch some of you guys' videos that we have not watched so far. I haven't been grading them. I was going to let you guys watch a few of them and just get an idea before I put some grades on your thing, because I want you to see what, for lack of a better way to put it, you know, I want you to see what some of your classmates did. So, you know, I don't even remember if it's a 100-point scale. If you see some and you look and you watch it and you're like, mine really wasn't quite that good. When you see your grade, you'll have a little bit of an idea if y'all have seen some of the other videos. That's why I have not hurried to put grades on those things yet, because I want to watch them in here, get some feedback from you guys. And when we do this, when we start watching these videos, listen, we talked about criticism in here and constructive criticism. I'm going to ask y'all to critique each other, and I want y'all to actually talk about this stuff, because I want it to be a learning experience of, hey, we're watching somebody run a recreation activity, and we're not making fun of anybody. We are not trying to shred anybody. We're trying to help the group as you're being critical, which is helping you to learn the steps and watch what's going on and share, where we can all learn together how we can give the best to our clients that we're working with. It's not about cutting each other down or anything like that. So don't think that when we watch your video, if somebody says, I don't want you to get in a fight in the parking lot after because somebody said something bad about your video. Okay. That's just part of what I think it will help if we talk them all over. So that's where we're going to go. So next class, let's see. I think that's it. We're going to do chapter 14. The hypothetical case study is due next Tuesday. And I'll let you know when the test is going to be. I hate to do it on the same Tuesday as when you're bringing the hypothetical case study, but it may be. I'll let y'all know Thursday when the test is going to be. So y'all have a good rest of your day.